Anatomy and Physiology 1, Chapter 8, Appendicular Skeleton. Okay, so the appendicular skeleton is the rest of the skeleton, and I'm referring to what we previously talked about in Chapter 7, which was the axial skeleton. So the appendicular skeleton is going to include 60% of the bones in our body, and it allows us to move and manipulate objects. It's going to include the bones of the limbs and the girdles or attachment bones that attach those limbs to the axial skeleton or body, your core. So we saw this figure in Chapter 7, and we were focusing on the yellow highlighted area in this picture. But since we are now talking about the appendicular skeleton, we are focused on the non-highlighted areas of the skeleton, which is going to include the arms and the bones that attach the arms to the axial skeleton or trunk, and the legs, and also what attaches the legs to the axial skeleton or trunk. So let's start first with the pectoral or shoulder girdle. The pectoral or shoulder girdle is responsible for connecting your arms to your body. The movements position the shoulder joint, and it gives a great basis for arm movement because of muscle attachments. Each girdle consists of one clavicle and one scapula. So reviewing, the clavicle would be the collarbone, and the scapula would be the shoulder blade. So as I mentioned in Chapter 7, this chapter is not going to go over the details and names of the features of these bones. We are simply designating what belongs in the appendicular skeleton and the specific high points about how it serves your body. What you will do in Anatomy 1 typically is you will have a lab that you will have to learn all the parts of the appendicular skeleton. So that will be done during lab time. Okay, so here is the clavicle on its own, and the clavicle kind of has a lazy S shape to it, sort of like a squished S, a nice curve. And then the scapulae are the shoulder blades. They are broad, flat triangles, and they join with the humerus and the clavicle. So we'll take a look at that too. The lateral angle of the scapula supports what's called the glenoid cavity. So that's going to be the socket that the humerus pops into or articulates with. This is going to form what we call commonly our shoulder joint, but more fancy sounding is the glenohumeral joint. So here's our scapula, and you can see that it is quite flat. If you remember from Chapter 6, it was designated as a flat bone. And over here we have a socket, and that socket, and we'll look at it head on in just a second, but that socket is where the humerus or upper arm bone is going to pop right in. This edge here is the lateral angle because it faces away from your midline. So if you look at this skeleton here, you can see that this scapula is taken directly from that orientation. So the lateral angle would be facing away from the midline, and the lateral angle is where the the humerus will attach to the scapula to form the shoulder joint. So here is the scapula head on. This is a lateral view, so we're looking right at the socket, And that socket is called the glenoid cavity, again, where the humerus will articulate or join. Okay, so the appendicular skeleton, of course, includes the upper limbs, which is bones of the arm. Arm would be shoulder to elbow, forearm, wrist, and hands. So let's start with the bone of the arm, which would be shoulder to elbow, and that is the humerus. So the humerus is a long bone going back to chapter 6, and it's highlighted here. There is a head on the humerus that will attach to the glenoid cavity. And then down at the other end of the humerus, this is where the elbow joint is going to form with the bones of the forearm. So the forearm consists of two long bones, the ulna, which is medial. So remember, anatomical position, your palms would be facing forward. So the ulna is closest to your body and lines up with your pinky. And the radius, if you're in anatomical position, would be lateral or furthest away from your core. And the radius is going to line up with the thumb. So here are the bones of the radius here and the ulna here, bones of the forearm. And that moves us into the wrist and hand. So the wrist is also known as the carpals. There are 8 carpal bones, 4 proximal carpal bones, and 4 distal carpal bones. These will allow a wrist to bend and twist. So looking at the hand, palm towards you, you can see a row of proximal bones and then a row of distal bones. So distal, remember, means farther from the point of attachment. So the point of attachment is way up at the shoulder, if we're going all the way up, and that's the bottom, distal carpal bones. Then we have the metacarpals, which make up the palm, and the phalanges, which we'll talk about next. So this was a view of the carpals, so we'll come back to the phalanges after this slide. So metacarpals are the 5 long bones of the hand, numbered 1 to 5, Roman numerals, from lateral to medial. So looking at the palm, these are the metacarpals, and they are numbered 1 to 5. Number 1 will always be the thumb. Number 5 will always be the pinky. The pollex, which is the thumb, has 2 phalanges, proximal and distal. Each of the other fingers has 3, proximal, middle, and distal. So here's our pollex. Remember that this is the palm, so this doesn't count in the phalanges. The phalanges begin here. So there are 2 phalanx bones in the thumb, proximal and distal. In the other 4 phalanges, we have proximal, middle, and distal. So 3 bones in each phalanx, as you can see, from index finger to pinky. Next we have the pelvic girdle. So the pelvic girdle is what is going to attach the legs to the core or axial skeleton. And it consists of 2 hip bones, also called coxal bones, pelvic bones, os coxa as well. It attaches to the lower limbs and is very strong so that it can bear your weight and give you mobility. It's part of the pelvis, but it is not the same thing as the pelvis. Each hip bone is made up of 3 fused bones: the ilium, ischium, and pubis. So here is the os coxa or coxal bone, and you can see that it was once 3 bones that have now fused. So we have the ilium, which is the large hip bone up at the top that you can feel through your skin when you touch your hip. The ischium, what you sit on, and then the pubis up front. Ilium, ischium, pubis together make up the coxal bone or os coxa. You can see as well that there's a socket in the os coxa called the acetabulum, and this is where the femur or upper leg bone is going to articulate or pop in. So we'll come back to the femur. Now, I mentioned before that the pelvis is not the same as the pelvic girdle, and it isn't. So the pelvic girdle is made up of 2 hip bones, 2 os coxa. The pelvis, on the other hand, is made up of 2 hip bones or os coxa, a sacrum, and the coccyx. So you can see that we are including the axial skeleton when we are talking about the pelvis. Okay, so this is a picture of the pelvis, and we can see the os coxa here, os coxa here, and then in the middle is the sacrum, and the coccyx or tailbone is back behind. We can't really see it in this view, but we can see it in this view. So the male and female pelvis is clearly going to be different, and the main reason is childbirth. The female pelvis is going to be broader relative to body size, smoother and lighter, less prominent markings, shallower iliac fossa, a wider pelvic outlet, and triangular obturator foramen. So here's a picture where we can see some of those points. So over here on our right is the female pelvis compared to the male pelvis. So some of the highlights. So the female pelvis is going to be broader and smoother, less robust. We're also going to see that these indentations here, these basins called fossa, are shallower in the female than they are in the male. The opening of the pelvic outlet is narrower in males than it is in females, but again, makes sense. Baby has to pass through this opening. Okay, and then we also can see that these openings here called the obturator foramen, they're more triangular in females and more oval in males. And another really noticeable thing is the angle between the ischia in males is typically less than 90 degrees. In females, greater than 100 degrees. So again, these are things that are all related to childbirth. So the lower limbs function in weight bearing and movement. The bones of the lower limbs include the femur, which would be in your thigh, the patella, which is your kneecap, tibia and fibula in the leg, tarsal bones, which are your ankles, metatarsals, the sole of your foot, phalanges are your toes. The leg is the distal portion of the limb from knee to ankle. So the femur is the longest, heaviest bone in your body. Here's the femur. It does have a head on it, just like the humerus has, and that's going to allow it to pop into the os coxa, into that socket called the acetabulum. The patella or kneecap is a large sesamoid bone. We talked about those back in chapter 6. The bones of your leg are the tibia and fibula, so your shin, and they are bound tightly together by something called an interosseous membrane. I'll show you a picture of that in just a second. So the tibia or shin bone, that's the one you really feel when you touch your shins, kind of feels sharp on the front. This is a large medial weight-bearing bone of your leg. The fibula is lateral, so it's going to run along the side of your leg. Okay, so here we are looking at the leg from the front or anterior view. Here's our tibia. And then running alongside is the fibula. And you can see in between there is a membrane there, a tight membrane that helps to anchor the two together. That's called the interosseous membrane. The ankle, also known as the tarsus, consists of 7 tarsal bones. These are bones you'll learn in your appendicular lab. So here are the ankle bones. There are 7 again. And then we have metatarsals, which is the sole of your foot. 5 long bones of the foot, numbered 1 through 5, Roman numeral, medial to lateral. So we see the same thing mirrored here that we saw in the hand. Number 1 will always be the big toe. Number 5 will always be the pinky toe. The big toe, also known as the hallux, is similar to the thumb in that it has only 2 phalanx bones, the proximal and distal phalanx. The 2nd through 5th toes are going to each have 3 bones: proximal, middle, distal, proximal, middle, distal, proximal, middle, distal, proximal, middle, distal. So skeletal features can reveal your muscle strength and mass. So bone ridges and bone mass can be indicative of muscle strength and mass. Medical history can show in teeth and healed fractures, sex and age, bone measurements and which bones have fused, and body size. Modifications in the female pelvis for childbearing. The hormone relaxin, which is released during labor, is produced during pregnancy, and it helps to loosen up the pubic symphysis, which is, I'll go back and show you exactly where that is. So this little disc of fibrocartilage is the pubic symphysis, and relaxin is a hormone that will soften that so that the os coxa are a bit more flexible and can spread just a bit more so that we're able to push a baby through. This can increase the size of the pelvic inlet and outlet. So this will conclude Chapter 8, a review of the parts of the appendicular skeleton. So we'll meet again in Chapter 9, which is going to cover joints or articulations.